everyone, and welcome back to another episode of the Student to Life podcast, where learning and unlearning has no limits. I'm your host, Stretch, and today we have a very, very special guest in the building with me today. We're going to have a great conversation. We have Dr. Renee with us today from Dykal Wellness.
Yes, sir.
And if you know me, you know I'm all about health and wellness, so I'm talking to the right person today. So, Dr. Renee, what's going on?
I've been better, but now that I still know, I actually feel like I'm really good.
So, before I get into the conversation, I ask my guests to tell me a little bit about themselves,
Okay.
to humanize my guests, to let people know who this information is coming from. So, tell us a little bit about Dr. Renee.
So, born in Jamaica, raised partially there, grew up in New York, and transplanted to Florida. I went to the Wilmer's Girls High School. Pick up yourself, Agakwadagis. Absolutely. I actually was supposed to go to medical school in Jamaica, and my mom shipped me off on a one-way ticket to New York to my dad. While I had plans, she had plans too.
Right.
Because my then boyfriend was, a little bit too close. But I ended up marrying him, so, it worked out.
Hey, look at that.
So I've been in healthcare for 20 years, and I know I am looking 21, so thank you, But yeah, I have focused majority of my career mostly like on women's health, and just started incorporating some men's health into my practice for the past 3 years, and this is us. This is Dykal Health and
I have some
Wellness.
questions about the men's health part too.
Okay, I'll be happy to answer.
So, you always wanted to be a doctor?
Always wanted to be a doctor, ended up becoming a nurse practitioner, but I have my doctorate in nursing practice. I like to clarify that part.
What makes a person want to be a doctor, though?
It's always just being able to help someone beyond what just the basic life skill can offer. And for me, it's being a servant to the people.
Okay.
You have to have a servant's heart to be in the medical field, whatever your role is. Because it's not always, the peaches and cream that you see on Grey's Anatomy. It's real life. It's you actually impacting somebody's life. And sometimes that's the only chance you have.
My aunts used to, when I just moved here, they used to pressure me. I was like, yo, the medical field is always hiring.
It is.
And there's always money there to be made, and you should go into the medical field. And I thought about it. I was like, I don't even like touching people. I don't like bodily fluids. I don't like bodily fluids. I don't like to touch people.
That's a limited aspect of the medical field, though, because there's so many openings that you could get into. For example, my husband, even though he does ICU and he's a bedside nurse, he also has his degree in nursing informatics, which is pretty much like computer technology. Okay. So he's working with that aspect of life. And if he never wanted to touch another patient, he didn't have to.
Still never wanted to. And I'm glad I didn't take anybody's advice and do what everybody
You do what you love.
wanted me to do. I was like,
Yeah.
So where does the word dicol come from?
That's a good one. So our goal in life has always been to have at least 2 children. While they have not yet physically manifested, we have names picked out for these 2 children. Okay. So it's actually a coin. Di is for Dylan, our son, and Kal is Kalea, our daughter. So it's a coin of their names.
So you're manifesting your boy and girl.
Absolutely. And
so no kids yet?
No kids yet. Yeah.
Okay.
Yeah. 21, we're still working on it. Dylan and Kalea. So, it's coming.
So why did you decide, for a lot of people, they work in a hospital, they work for someone. Why start your own practice?
I did it all. I did the working for someone. I did the hospital route. I actually started my first job in healthcare in 2006 in a hospital in Texas. So I've had that experience, and I saw the gaps in healthcare. And I realized very quickly that if I truly wanted to make an impact, I'd have to do something for myself, because no one system can tackle all of those things.
Right.
So I wanted to create a boutique practice that was going to really help and focus persons on the, those disparities, try to get rid of those gaps. So like the long wait times, we don't have that. The crazy booking and it's all like 3 months ahead. You can get an appointment same day or next day with us. You don't come here and see a whole bunch of persons waiting because we're big on privacy. So we want patients to be gone before the next person comes.
Yeah.
So yeah, that's why we created something that would be comfortable for persons, something that was very different. It was unique. And we also have a concierge option. So if you did not want to come into the actual office and you wanted us to come to a hotel or to your home, we can provide those services there.
Wow.
Yes.
So you thought this through.
Absolutely. Absolutely. It again, you're working in healthcare 20 years. My husband, combined for both of us, is over 3 decades of experience.
That's crazy. But that's what I was gonna get to. Like, how long this whole schooling process takes?
You know what?
And how far you have to go, like a master's, doctorate?
For the average person, they can certainly start off with an associate's degree, which is pretty much what we did in order to be, get into the field. We weren't from the homes that we had gold spoons handed down to us. So of course we needed to go to work right away.
Right.
So we got our associate degrees, and then while working, then we got the Bachelor's of Science in Nursing. And then for me, I decided I wanted to go all the way. So I have 2 master's degree, and then I went for my doctorate. Same thing with my husband. He has 2 master's degree, and he's looking at me sideways like, I don't want a doctorate in nursing. So he actually does have a doctorate, but it's not in nursing.
What?
Yes.
Listen, I don't know how y'all.
Yeah.
Listen,
Just a little different.
like my mother always said, you're a bright boy, but I just never really, I don't know. I just never really liked school like that.
I get it.
I
and
did
it's
it
not for everybody, Trust me.
Yeah,
it's tough.
I'm good at it.
Yes.
Don't get me wrong. It's not like me going to class and I had my head tough.
Right,
No,
right.
I was good at it.
Right.
But
It's just not, that commitment isn't there to do that all
because it's like what I really want to do is be outside doing things. I'm more physical
Gotcha.
than anything else.
And I think the learning styles are different for many of us.
Definitely.
So it has to be where you're getting into something where if you're going to learn, might as well learn the way that you're able to learn the best way.
I think now I am getting to the point where reading more. I wish I did that earlier.
I see.
Because now it's like difficult for me to read a whole book in one sitting or even 4 or 5 chapters in one sitting. I have to read, give it a break,
of course,
read again, and then it's just like building back up that tolerance of sitting down in one place and reading for that.
Do you find that you're more of a visual learner or an auditory learner? Because there are these, okay.
Because it's like,
a combo.
For me, reading, it sticks more.
Okay.
The audio, I have to literally clear my head because sometimes my brain
is just all over.
Goes off into something else, and I have to rewind back the audiobook again.
What did you say? Oh my gosh, yes. I get that.
So at Dykal Wellness, give us a list of things that you offer here.
So we are listed primarily under primary care. So when you think primary care, you're thinking health maintenance. So all of your contraceptive needs, including IUDs, Nexplanon, of course, oral contraceptives, we do, Depo-Provera, things like that. We also do sexually transmitted infection testing here, and you can have everything done in the office. We do all sorts of blood work and testing. So anything that relates to primary care, management of chronic conditions, hypertension, diabetes, dyslipidemia, things like that. Outside of those primary care things, we also have some specialty items. So, of course, most persons know we do offer an amazing, I will call it a metabolic reset program, not just for weight management. That is one of the side effects that we hope for, but also managing and helping people to work with their hormones, help to balance that out for both men and women. So we do testosterone replacement therapy, helping to manage men with erectile dysfunction and,
we're gonna get
things
there.
like
Keep
that.
going. We're going to get there.
And of course, we're big with women who are trying to get pregnant. So infertility management, people with polycystic ovarian syndrome. So we absolutely have a plethora of things that we do.
It seems like you can keep going.
Yeah, we can keep going for sure. And of course, we offer these services both in-house and again, telehealth. We can do consultations. Anything that requires a physical exam, though,
I
will
take
require
insurance.
you. I take two different types of insurance. We
Hopefully
are
it's one of mine.
actually we actually are with Memorial Health Network for their employees and with Oscar Health. However, if you do have an insurance that we don't take, you can just pay our office fee and then we can use your insurance for your meds, your labs, if you needed ultrasounds, anything else outside. We can use it for those things. So the office fee is pretty much just like your copay. That's all you'd pay for us.
Okay, so let's touch on a couple of those things. One of them, which is the one that we talked about before, which is a weight loss program. I want to touch on that a little bit because I used to be a personal trainer,
Right.
and for a lot of people, I have these conversations with them. I'm sure you have these conversations with
Every
them,
day.
where it's like you come in, I train you, you're losing weight, you're doing good, or you're not losing any weight because you're working out, but your eating habits are terrible.
Right.
And you come in, like for me, it's probably a harder conversation because after 2-3 months, a lot of people will say, "Oh, I'm not losing weight as rapid enough." And I'm like, if you've eaten bad and never worked out a day in your life and you're 25 or 30 years of age, 3 months is not going to reverse those habits.
Absolutely.
And I understand that you can't just go cold turkey and stop eating certain things.
No.
Start somewhere. And for a lot of people, it's a mindset thing. It starts in the mind. So
absolutely.
tell us about the weight loss side of things.
Yeah. So I'm so glad you brought that up, that even with the exercise portion on board, that after 3 months, you're not having any guarantees. Because I do think that people come into this program and others with some very unrealistic expectations. Now, I'd like to preface this by saying metabolic dysfunction, which is truly the underlying cause of many of the things that we're facing, that did not happen overnight. Some people, this is decades in the making. However, I realize that when persons are spending a little money, that they feel it when they spend it. So that could be, for me, a $50, maybe for you is $1,000, right? But when people are feeling that spend, they want to see an immediate response to whatever it is that they are doing. And they have brought that mindset over into resetting this metabolic dysfunction. And it does not work like that.
Exactly.
There are no guarantees. And we use different types of therapy, but there is, of course, a popular therapy now. But this med line has been around for over 20 years. And it is well studied, well researched. However, I like to let people know, for chronic disease management like obesity and, all these metabolic disorders, you have to attack them from a chronic perspective. The minute you take your eye off of this thing, it's like frying plantain. It just burn up real quick, just burn up. So you really, really need to pay attention and treat this chronic condition as a chronic condition.
Right.
So it's not going to be an overnight process. It's not a sprint. You're going to have to trust this process. And there's a lot of lifestyle adjustment that comes long before you come to this office to even set up an appointment.
Right.
If that didn't happen before, then it's going to happen in tandem and it's going to be much harder for you. And there's no quick fix.
Right.
This is
we're
not
talking
a microwave.
We're talking about Ozempic.
Yes,
Okay.
we're talking about meds like Ozempic.
Okay.
And
So it's not only Ozempic. It's
not
different
only,
meds that is similar.
exactly, tons of options, because Ozempic mostly is for diabetics. Semaglutide, which is the component of Ozempic, there is Wegovy, which is directly for persons who are looking to lose weight. So I know most persons hear the term Ozempic and they're thinking, oh, that's the only thing. No,
Right.
that's the one that is FDA approved for people with diabetes. And that's diabetes type 2, if I may add, because
Right.
there's multiple different types.
Yeah, because I heard about the 1 and the 2. Yeah.
And there's LADA as well. There's one that's like right there in the middle that it's more of an autoimmune.
And you have the pre-diabetic.
Exactly.
Yeah.
So there's tons of things that I like to say to persons when they're coming in. set your expectations. Don't come in and be unrealistic with us, because then we're working with you. We're going to give you the tools. But if you don't follow through, if you don't change up the diet, if you don't sleep well, if you're not managing stress well, all of those things are big factors.
Right. So the big question is, because I would say I try to be as natural as possible. So is it safe?
Absolutely.
Is the question, because we see that a lot of meds are not really safe for people. So just wanted to really let people know that it's a safe thing to use, and there's no a lot of side effects to it.
So the therapy line, it's called glucagon-like peptides. So these peptides have been around, again, been studied for over 20-something years. So you're talking about solid research. Most research studies are about 48 weeks long. And if you're going through multiple of these trials, believe me, it has to be something that is well researched and well studied before it's even released on the market.
Right.
And when you have over 20 odd years of data on this particular therapy, it's something that's really solid. Of course, as with anything else, it's going to come with side effects. So let me just say this. Think about a medication people take for fever and pain, Tylenol. Not knocking Tylenol at all, but you're talking about in high levels, Tylenol can cause liver damage. Tylenol can cause issues with tarry stools. If you take ibuprofen, for example, you could end up with a GI bleed. You could end up with kidney failure. You could end up with all of these things. So when persons highlight this one particular therapy and say, oh, it's bad, I want you to look at some of the very things you're taking over the counter and put that into perspective. Nothing is without a side effect. What I want to ensure for you is that it is safe and in a dose that you should be taking. So when persons are taking this and borrowing meds from their friends and getting it on the low for a cheaper price, and I get it, hey, you got to do what you feel like you got to do, but be safe about that. This is not a medication that you want to play with, just like with Tylenol or Motrin or any of those NSAIDs on the market.
Right.
So it's not one that I would say, oh, just go ahead and take it and don't follow up. No, you're going to have follow-up visits with us.
Right.
You're going to have your blood work done before we start. We need to see what's your baseline, what's happening with you. Is this a safe therapy for you? Is your liver working to process this med? Are your kidneys working to process this med? Because it's got to be excreted by some way, and it's got to be processed somewhere. So if I don't have that amount of data points, what are we doing?
So there's another question that somebody mentioned to me. I did not research it myself, so I'm asking you to for that information. So they said that when you do Ozempic, you lose muscle mass too.
You can, as with any other weight loss medication. I will say that. So you have to ensure, again, that you are under the care and guidance of someone who is medically astute in knowing how to manage this medication.
Right.
Because if you are rapidly losing weight on any therapy, you can certainly lose muscle mass. With our program here, we start off with what we call a bioimpedance. So we are checking all of those data points, those biometrics prior to you starting. And between 3 to 6 months, we're getting this repeat. We also offer you a body scale that allows you to track those metrics with every measurement. So if there was something that showed, oh my gosh, this person is really losing muscle mass, we need to kind of intervene long before this 3-month mark, because this person is sending us these numbers every 3 weeks.
Hey, this Mother's Day, May 11th, make sure you come out to the Art of Music Festival going down at Sunset Cove. You don't want to miss Maxi Priest live on stage, my girl Allison Himes, legendary Third World, and of course your boy Papa Key's going to be in the building. Make sure you get your tickets at Carib Tix right now. You don't don't want to miss the Art of Music Festival. Mother's Day Sunday, May 11th at Sunset Cove Amphitheater. We going to Boca, baby. Let's get it.
And we're seeing exactly where they are on that.
Right.
So we lead a protein forward type of a diet. Not necessarily high protein, but we make sure we're stressing you have to have your protein. This is not one of those where you don't eat. This is not one of those yo-yo ones where you just fast forever and ever, amen. That's not it. We give you 5 meals a day. It's 3 meals and 2 snacks.
Okay.
And we don't cut the snacks out because we do understand, right? And some persons, based on their job, they're not able to eat and like a formal meal. They can grab some granola. They can have some almonds, something like that.
We're going to get to that part as far as the food choices.
Okay, good.
Because we're going to, get past the medical
right,
stuff and we'll get into some other things.
Totally,
So,
yes.
in my personal training class, I did personal training class like 8 years ago.
Okay.
I'm not a trainer anymore because it was so annoying. For everyone that was my client, I'm sorry, but you guys were annoying.
Oh my gosh.
But I did personal training class about 8 years ago,
Okay.
8 or 9 years ago. And in personal training class, they told us that if the client is losing weight, I think the safe weight was 5 pounds per week.
Oh, that's a lot of weight.
I think it was anywhere between 2 and 5.
So we are a little bit maybe more conservative. We're 0.5 to 2 pounds per week.
That is it.
Okay.
2 pounds. Yes.
Yes.
That is the safe list.
Okay.
Anything
Okay.
over that, everything
It's
over
too
that per
much.
week, it's too much.
Yes.
And it's not safe.
Yes, exactly.
So that is what I was going to ask you. Is there a way where you can gauge that?
Yeah, I mean, for our patients, again, we're starting them on the lowest of the medication, just like what the manufacturer says. And I don't necessarily go up on the high doses if I don't have to. If you're doing well on a low dose, meaning you are not having symptoms that are impactful to your quality of life, you are actively losing weight, all of the metrics that I'm looking at, blood sugar, blood pressure, those things are under control. There's no need for me to rush to the top.
But a lot of
People love to get to the top because they associate a higher dose of med with a more rapid weight loss. And that couldn't be more further from the truth.
Right.
A higher dose of med in some cases is more equivalent to more symptoms versus actually having better outcomes.
Right.
So I like to take it low and slow. I've been on this therapy myself, and I'm telling you, it is life-changing, but my best weight loss happened on lower doses.
So let me ask you, right? Like I said, I could relate from a personal trainer standpoint where we see a lot of people, they come, they have progress, and they stop and they resort back to the bad habits.
So with our program, I am very upfront with people. I will say to them, if you are thinking of coming off of the med for reasons, whatever it is, and it's mostly like financial, let us discuss an alternate option for you that may be more economical. So we might move over into an oral option that they can afford. And it is okay, they're not breaking the bank, and we can maintain on an oral option. But my first preface was saying a chronic disease requires chronic management. So this is not the case where you would tell your hypertensive patient, you know, you look good. You had 1 or 2 great blood pressures. You can come off. No.
So when does that person come off?
You don't have to ever come off of it. If you're in a place where, say, for example, you were someone with diabetes, these people are probably going to be on for quite a long time, maybe even the rest of their lives. However, for our clients, if they've met their goal, then we can take them off and then put them on an alternate type of a treatment that will help them to maintain. But you don't not maintain. You don't not just have something in place.
That is where I was getting
That's the problem.
That's where I was getting to. So,
yeah.
So, for a lot of people, especially, I always throw them in there, the people who go do their bodies, the BBL people. I say to them every single time, I say, listen, if you go and do your body and you had bad habits before, it's a 90%, a very high probability
Absolutely.
that you're going to resort back to your bad habits. You're going to say, I'm going to do my body, then I'm going to start going to the gym and I'm going to start eating healthy.
Yeah.
That's unrealistic.
Very.
So is it the same thing? Because we see where people see the results and they get excited and not understand that this is something now that you got to change your eating habits, your working out habits, stress levels you have to work on. So a lot of people will resort back to gaining back the weight.
And so far with our program, like in this office, it's been 3 years. I haven't had persons who have just ultimately gained back their weight just like that. It's usually somebody who will come off and just be cold turkey and just say, you know what, I have this part going on in my life and I don't want to necessarily say waste my money, so to speak. All of the other persons who have met their goal, they've all actually listened.
Keep it on a level.
Yeah, they've listened, because I'm telling you, people have been trying to do this their own way for a very long time. And now when they're coming into something that's more of a structured approach, something I'm showing them, this is the evidence that says that you will gain it back if you do not take care of it. The hypertension, because we're Black people, it's not just going to go away because we wished it to.
Right.
The little lemon water they told you to drink to lose weight, that's not going to work for you. You need something that is going to keep this metabolic dysfunction from just rearing its ugly head again. And sometimes it's these hormonal imbalances that are causing the weight gain for women.
For some,
You're
yes.
talking about the contraceptive use, the oral contraceptives. You're talking about Depo-Provera. That's a big one. I've seen somebody go from like a nice, cute little Coca-Cola bottle shape, as we call it, to being over 100 pounds overweight just on Depo-Provera, for real.
But I don't want to. I'm gonna push back on it a little bit, and this is just to get the conversation going. So for me, I always recommend the diet change,
Of course.
first, only because diabetes is chronic in our culture because
What we eat.
of mommy used to eat, grandma used to make this. Then grandma feed mommy,
Yeah.
mommy feed you.
We passing it down.
And it's not because it's what do you call it, hereditary. It's because you're feeding your kids the same thing that you were
Everybody
fed.
else were fed.
Right. So reversing these metabolic issues that a lot of people have is also as a result of those things.
Of course.
Right. So
Absolutely.
what I usually recommend to a lot of people is changing to as close to plant-based as possible.
Absolutely.
And yes, the Ozempic or the weight loss drug is a start, and
Yes.
it's also a boost.
It's
that
a
help.
tool.
It's
It's
a
a
tool.
tool.
So you can utilize.
Yes.
That's why I asked if it was safe.
Of course.
But on the other hand, research is very important on the
Absolutely.
other person's end, because they don't. You don't want them to look to you for all of
Everything.
the answers.
Absolutely.
That's what I'm saying. So, what are some of the practices that you would implement to people to say, all right, do these things to maintain or to get better? What are some of those things?
So, just as you mentioned with the diet, I actually provide each patient with a dietary program. It's not necessarily one where you have to follow A, B, C, just like that. But it's one where I give you some options. So, you tell me about some of the foods that you're typically eating. I'm not going to put all of it on there, but I'm also not unrealistic. I know that, okay, this person is going to eat the Oreos anyway.
The piece of
So
pork,
I'm going to look to see what can fit in their macronutrients for the dessert.
Sure.
When I've added the desserts that they thought they could not live without to their first diet plan, everybody thought, yes, they're going to be able to jump on that and get it. You want me to tell you that medication changes your palate, changes your affinity for certain foods. So your love for this thing that you couldn't let me tell you, they never even got down to that part.
The Oreos.
The Oreos just stay there, and it's just in the kitchen for no apparent reason. The KFC that we thought we could not live without, I think I might have said this to you on my 5 trips to Jamaica last year. not one purchase of KFC. People are coming up from Jamaica and nobody is calling me to ask me anymore.
Right.
Should we bring this? Because I'm just like, no,
I
we
got the
don't
request
eat that.
all the time.
Anyway, we don't really mess around like that.
And like we were talking about earlier, it's the same thing with changing. Because ever since I stopped eating meat in 2019, early 2019, late 2018, because I never liked red meat to begin with.
Okay.
And ever since I was growing up, I was forced to eat it. I never liked beef. I never liked pork. I never liked whatever we call it, mutton. I didn't like
None of
oxtail.
it. Oh God, you're not even Jamaican.
Listen, it was exactly. It's what I'm saying. It was a point where they would boil the soup, and I didn't even want the actual soup. I would take out the dumpling, I would take out the yam, and I would eat it with butter or something.
Oh my.
But guess what? I love the dairy.
Gotcha.
I love the dairy, desserts, ice cream, you name it. That was me.
Okay.
But ever since I cut all of that stuff out, the smell of meat
just turns you off.
Turns me. A year after I stopped eating chicken, I went back to Jamaica and I was like, "Shout Jamaica, you know, it's not gonna hurt me to eat a piece of chicken."
Right.
It didn't hurt me to eat chicken, but to me it tastes terrible.
Wow.
It's salt. The salt level.
Just different.
Everything was different.
And this was what you loved maybe a year or two before.
Oh yeah, I was eating chicken like me raised the whole coop.
Wow.
You know,
that is funny.
Everybody could tell you how much I used to eat a lot of food.
Wow.
But no, I'm very mindful of what I eat. I try to be I'm not perfect at
yes,
it.
yes.
Because I still have things that I'm not supposed to be eating.
Of course.
But I do indulge, here and
I
there.
like the fact that you're honest about that by saying, I am intentional about what I'm putting in my body. I'm not just eating for satiation only, but I'm eating to ensure that these are actually the things that my body is requiring. These are some of the good nutrients that I'm looking for. And I think that's important to note. And when we're talking to people, we make those points. You need these micronutrients and you also need these macronutrients. I don't take any macronutrients out of their diet. I do put the carbs there, but I'm showing them, okay, based on your total daily energy expenditure, and we break it down, this is what I am anticipating that you should have. These are the calories. These are, all the things that I'd love for you to do. I'm not asking you to count calories, but be mindful.
Yeah.
And I want you to probably in the first month kind of count or write them down, because everybody thinks they're eating 1,600 calories until they start writing it down and it's actually 3,200.
Exactly.
It's twice the amount. And we think we're a good gauge. We're always a good gauge of character. But the men you've dated told me that was a lie. So it means the food you're eating, it's not 1,600 calories, sis. Like, can we be real here? And when they come back and they're like, geez, I never... Yeah. Yeah. And because it's happened to me as well. And I'm very realistic. I'm very transparent about my journey. I said, girl, I wasn't trying to shade you, but I was really trying to tell you, you have not eaten 1,600 calories in 10 years or more. You have been overeating and you don't really think about it like that, but everybody thinks they're eating way less.
I think a lot of people, the misconception is you have to eat animal products to get a certain level of nutrients, which is very much false. I don't know if you might notice in our history doesn't have us eating animal products. The Caucasian race introduced that. They're the ones who can break down animal
much
products
easier than we do.
Our bodies are made to break down plants, vegetables, fruits.
And you see how it responds in our bodies. When we eat meat, chicken, all of this stuff, it's the slowest process.
And it cleans up everything from body, mind, everything.
Everything.
Right.
You feel different. If I eat a piece of steak right now, I'm telling you, I am going to feel the impact of that steak as much as I liked it for at least 3 to 4 days. It's just I feel bloated. I feel like just completely distended. My pants are going to fit different. By the time that thing goes through my system, overly
And
inflamed.
for us, it takes, what, 5 months to completely get out of your system?
Listen, it's a long time for some people. For some, it might be like a good, few weeks, and others, if you had other metabolic issues or other digestive issues, you're talking months
Yeah.
and not weeks
Exactly.
anymore. Yeah, so I agree.
So let's talk a little bit about the the testosterone side of things.
Yeah.
Which you mentioned, but I didn't know you could do like a
Absolutely.
surgery to
Listen, you
talk to me about the
have
testosterone
everything.
thing. As
Yeah.
I'm talk to me about this
So
thing. Yeah.
let me just say this. You've talked about the dietary portion and how it has impacted, our society. I'm going to say that based on the things that we've been eating and the amount of hormones that are in the foods that we're eating, especially when we are not able to afford the nicer options, the Whole Foods and the Trader Joe's, right? Those things have unfortunately changed our DNA in some way. It has changed our hormones and how our body is responding. So now I am having men 28, 29, 30 coming in. Initially, it starts off sounding like depression, anxiety, brain fog. I can't focus. I am not feeling that great at work anymore. I just feel like work is just okay for me. And you hear those things, and then you start asking about how is your sex life? And then you start talking about, do you have a morning erection? And you start getting looks like, wait, I was talking about depression. How did you get to sex life? But there is this nice little line that is connecting all of this. And when I start asking about the morning erections, everybody gets nervous, like, wait a minute, did I have? And they really realize maybe 2 out of 7,
And that's a
1
signal.
out of 7.
That's a sign.
Big sign.
Yeah.
Your morning erection is the body's way of nicely exercising your male part.
Yes.
And it's supposed to work for you 7 days a week. This is how it's supposed to be. That's the design. But that's one of the early signs that something is happening. You have very tiny arteries, very tiny. And if those tiny arteries get blocked for any reason, blood flow diminishes. And then you're having less and less. And then when you're supposed to be at attention for pleasure, you're also noticing that you may have 5 minutes and that's it. You're having less and less time.
And then you might drop asleep right after.
Literally, you're exhausted. You have no way to really put in any effort into this pleasure. And then maybe you got away with your Stoller activities. You got 30 minutes, but then you didn't have an orgasm. Wait a minute.
Or enough didn't come
Or
out.
there's something happening. You're looking at your actual discharge and there's nothing there. We have a problem, Houston. And I'm seeing men coming in younger and younger. Erectile dysfunction used to be this thing where the older guys, the guys in the late 40s and early 50s, the guys who we said they were going through andropause or this change of life, but it's hitting much younger.
A part of that, and I'm speaking actually from experience, a part of that is the increase in watching of porn, masturbation.
Yes.
That's definitely one of the other ones. That why younger, it's happening younger and younger. The desire, you literally kill your testosterone in that aspect of it.
It's true.
It's also behavior, because we see that a man that has high testosterone acts differently from a person who doesn't.
Oh, absolutely. Absolutely.
The way you working out definitely increases testosterone.
That's a big one too.
And a lot of guys, alcohol
And the weed.
and exactly.
Let's just put that one in there.
Marijuana
because
can decrease testosterone levels.
And it can decrease the good sperm count that you're supposed to have. So if you were ever thinking, I want a youth to know, I don't want to on the gelding truck, that actual practice by itself can decrease your sperm quality, your sperm count, changes the morphology of the sperm. These are all things that you're going to need in place in order to be able to successfully impregnate someone and successfully have an actual child that is normal.
Healthy.
Otherwise, you're talking about all different things. The Down syndromes, we all know. We're seeing a link to autism as well. So, men, you have a job as well. Majority of this DNA and the interaction, it's coming from you. You actually determine the gender of this child. You bring it in. You are the XY, So you are the one who's really... It's depending on you, sir. So, you want to replace the good nutrients. You want to make sure those micronutrients, things like zinc, selenium, copper, those are good things. Magnesium, your vitamin D3 with K2. All of those are excellent products to just have on hand if you want that good sperm quality.
And plants that make your blood flow.
Absolutely.
Have blood flow. Also, I want to ask you.
Yes.
Semen retention.
Semen retention.
Is that a thing? Because I've heard it thrown around. A lot of guys do not know about it and the benefits. So if you know, can you share a little bit about that?
I feel like semen retention is something that is practiced, maybe not so much in Western medicine. There are persons like in other countries that practice and it just came to me. Oh my gosh. They have a particular practice that they do. The guy in this one show, oh my gosh. I'll think about it. I'll try to remember it. But he was doing this, tantric methods. So he was using that to be able to stay as long as he could. He felt like semen retention was a way for him to increase his longevity, increase his stellar activities, so to speak. I don't see a lot of research necessarily on that to right away just say to someone, yes, go right ahead. I am not quite sure what the medical benefits are for that, but I am open to learning.
So from what I've read, from what I've watched, I watched a lot of podcasts about it. I heard holistic doctors mainly speak about it. It does boost testosterone.
Okay.
It has nothing to do with going longer.
Okay, this guy, he said it was a tantric move. So,
that is not the main reason for that. It's literally to boost your testosterone. That's one. The next thing is the mental capacity, because when you ejaculate, it also affects your mental capacity also. One ejaculation in each ejaculation is equal to like running 5 miles, I think, something like that.
Oh.
Yeah. So each time when a man gets tired, when you see him tired, that is why, because your body exerts that much energy when you ejaculate.
That is good to know.
So I don't remember if it's 5 miles. Don't quote me on that. But it's
some
it's
level
a
of
few
time.
Miles.
Okay.
Yes. It's equal to that. That's why a lot of guys are tired afterward.
Okay.
So semen retention really helps that with the energy levels also. So you might think it's just making him go longer, but it's just his energy level.
I see. So probably a little bit of a cross between the two then.
Exactly.
Okay.
So yes, it does help with men. It does. I've tried it, and it does work.
It does.
Yeah.
Okay.
So I think we need to look into those things also, because what a lot of guys don't understand is your come on, let the word come. Your prostate is a muscle.
It is.
And that muscle can be worn out.
Of course.
So understand that, yes, you can go 7 days a week, but that muscle needs to rest also. So a lot of guys thinking the more I do it, the better. That's why a lot of guys can't do it after age 50 or age 48.
And bringing up the prostate there, I just want to say men with persistently low testosterone levels are at a high risk for prostate cancer.
Say that again?
Men with persistently low testosterone levels that have been remained uncorrected are at a high risk for prostate cancer. So you certainly, if you're noticing like some of these signs that I previously mentioned, and you're not quite sure, like what exactly is this? Just have the test done. Total testosterone, a free testosterone, sex hormone binding globulin. Those are 3 easy blood tests to be done. And you can do the testosterone levels at different times of the day just to get a comparison. But it's very important, especially if the things that I've mentioned before. The decrease in libido is another big one. Changes in your athletic performance, especially for those guys, you work out, you know what you feel like when you're done.
Yeah.
And if
A lot of guys think you're gonna be so tired, like it's
listen,
you actually boost your energy.
You're not seeing those gains in the gym anymore, things like that. Please just have that checked out. The obesity thing too is a big
That's
deal.
what I was gonna get to.
Yes, that waist circumference for men, 40 or greater. If your waist circumference 40 inches or greater, that's considered obesity. That also puts you at risk.
For erectile dysfunction.
Yes.
And what a lot of guys don't understand, and I'm gonna tell a lot of guys this: what you eat is very, very important.
Super
Because
important.
a lot of the preservative foods boost estrogen. And the estrogen, that's why a lot of men now are growing breasts.
Yeah. And
a lot
that
of-
soy they told us was so good for us.
Soy is the devil for
Don't
us,
do it.
by the way.
Don't
Just
do
to let
it.
you know,
do
soy
it.
is the devil for us.
They introduced that to us and it made it look so nice.
Yes.
But it's not.
It's not. Just to let y'all know, I'm talking to the men because I know, because I do research on these things.
Exactly.
Soy, terrible.
Not just the milk, but the soybeans and things like that.
Preservative things.
Yes.
Terrible for us as men. That's why you see a lot of young boys acting so feminine.
Gynecomastia is
Yeah.
big in men with those kind of
Yes.
an issue where they're consuming high soy content. And that's just men growing breasts. That it has nothing to do with anything else. It's a hormonal imbalance.
And a lot of guy, I hear a lot of women say, "Why are the men so feminine nowadays?"
Listen,
The food has a lot to do with that, you know.
hormone
Just to let
change,
y'all
I tell
know.
you, the hormonal changes. It
Yeah. Anyway,
happens.
I want. There's so much I want to talk about, but
Yeah, I mean, you hit the testosterone is really, really good to talk about because I like the fact that from your perspective, you know, your previous career as someone who's training people, you can literally speak to them about this. Like, listen, if as a man, you're noticing that your workouts are not giving you what you need, just get the test done. There's no shame in your game
yeah.
if you needed to have that done. No, it is not going to be done as a routine part of your health maintenance panel. It is going to be a separate test that needs to be done. So it's you going in and just being honest with your clinician.
So you also do this hydration, IV, right?
IV hydration with nutrients that are replacing tons of the things we don't get in our foods, like we've said.
That is what I wanted to ask you about, because I was in Delray the other day and I was walking past this spot, promoting my festival, and she was like, "There's different ones. There's different IVs.
Tons.
We have IVs for energy,
Yep.
for different things," and I'm like, I did not know that. I know
Yes.
IV is something that we think about, like,
Just with going to the hospital, right?
no, actually, when we have hangovers,
Oh, well, we have that too. That's our famous banana bag.
that was what we mainly
Yeah.
thought about with that. But touch on that just a little
No,
bit.
I mean, I'm glad you brought that up. So persons who are usually out on the party scene and they feel like, man, I gotta go to work for 6 o'clock and it's like 3 o'clock and I'm still not feeling like the vibe is still out here. We have the perfect banana bag / a Myers mix for that. If, for example, you're having a bachelor party and your guys just wanted to get an energy booster, just something that's going to keep them up and, you know, they're going to be raving all night.
Really?
We've got a rave mix.
say?
Yes, we've got that too. And we could just come to your hotel. We'll hook you up with
natural,
your
I need-
fluids.
I need natural.
Absolutely natural. We're talking about B vitamins. B vitamins, most persons who are vegetarian are not going to get these. These are
I'ma go
vitamins,
get some of
B
that.
complex you're going to need, right? We have vitamins that if you are feeling like you're aging inappropriately and you really want to just look glowing and beautiful, we've got that for you too. You have NAD, you've got glutathione, you've got these antioxidants that are so helpful to, you know, get rid of these free radicals that are causing us to get sick.
Viagra too?
Do I have one that works like Viagra?
It's an energy boost.
Does he know
That's
who
why
I
I make
am?
sure.
I don't get called love doctor for nothing. I'm telling you.
I get to the love part
I
right
am the
after this, by the way.
sex girl, like anything to let the whatever go back in the pencil. Listen, I put it back in the pencil myself. Believe me.
All right, so you know, no.
Yes.
Yeah, we have
the lead to the pencil. Let's do
I
it.
got talk. So you're married.
Yeah, 21 years.
We're gonna touch on some general topics now, but
Yeah.
yeah, you know, cause we do the love show and
Yes.
we have a bag of things for the love show.
The crowd itself.
All right, so
Itself too far.
Tiff, big up Tiff. Anyway, so you're married for 21 years.
Yeah, I was 21. No, I said 21 years. I was a fetus when I got married, you know, because, yeah, that's how this works.
So it's your childhood
My
sweetheart.
high school boyfriend, we were at the prom together.
Prom.
I mean, the whole works.
So,
Yeah.
so,
want like a boyfriend, you know?
So hold on. May I ask you a question?
Yeah.
How does that? So you don't feel like you're missing out on anything?
I don't feel like I missed anything at all, to be honest with you. I mean, it's hard to miss what you didn't know about, you know, and I kind of live vicariously through my friends. I really do.
I'm telling the stories.
I live vicariously through my patients too, because believe me, my patients, I love them. They are just them full of vibes and them very honest. And I will have men come to the office and have conversations with me that leave me clutching my invisible Tiffany necklace. And I just have to keep that poker face and just be like, okay.
That's the next part I was going to get to.
No problem, sir.
So,
Yes, sir. Because I'm just like, me mama, when same do? Like, whoa.
so that's how I ask you
Yeah.
because you know
I live through them.
a lot of women have a very interesting 20s.
No, I didn't have an interest in 20. I just lived my life. Like, I don't know, maybe I grew up in a very strict Christian household. I met my husband on my way to school in a cab. Didn't take a cab before to go to school. We were driven into Woolmer's every morning. And that morning, my cousin's car was overheating and he had to turn back. So he let me off in Spanish Town. I'm at the Texaco gas station and this cab pulls up and he's like, "You're going Crossroad, right, Woolmer's girl?" I was like, "Yeah, that's where I'm going." I didn't know where to go. I was just so out of it. Like, I can't believe this car overheated. I don't know what to do. I'm going to be late for school. First day of school, so you know. And I got in the car, the gentleman came out, let me in, and then we were on our way. And I just realized that this guy beside me just kept talking. "It's early in the morning, sir. Like, why are you speaking?" And he's like, "I went to Woolmer's. My sister went to Woolmer's." And it was just talking. And I'm just like, mother of God. I'm only answering because I was growing up with a little bit of extraness, niceness. But good God, the man chat. So now when people meet us, they're looking like, "Me not think Kevin did that all I did then."
What's up, peeps? I'm back again with another ad to interrupt your episode, but don't worry, we'll be back real soon. I want to remind you that on Mother's Day, May 11th, we have the Art of Music Festival. It's our 4th annual Mother's Day Festival, and this year we will be in Boca Raton at Sunset Cove Amphitheater. We have Maxi Priest on the lineup. We have Third World on the lineup. We have the Soca Queen, Miss Alyssa Hines, is on the lineup. We have a gospel artist for you, which is Second Chance. And we also have TIFA on the lineup. We also have Visions Band that's going to be there. We also have Kumar Fire on the lineup that'll be entertaining you on that day. So gates open at 2 p.m. and we go until 10 p.m. So get your tickets now on caribtix.com. You can find us online at theartofmusicfestival.com or on Instagram, The Art of Music Festival. So go ahead and get your tickets right now. Don't wait too late. Now, back to the episode.
Kevin not talking.
Shut up your ears and get here like
That's
a G.
exactly what it was.
So,
and while I could have pilled him and give him a wrong number, I didn't. I gave him the right number, but not before the taxi man parked the car and said, "No move until me get the man the number."
Hey,
because
man.
when he got out of the cab, paid his fare, he's like, "So can I have your number?" The man put the car in a park. Everybody in the car turned around.
Number time.
The lady at the front was like, "Me like them. Them nice." And the taxi driver said, "That me I said to myself, you know, the girl look a bit fierce to do, you know, because she don't want to answer." And he's standing at the door like, "Okay, so what we doing?" And I'm just like, Jesus Christ, sir, you're not going, sir, the people them in the car need for
Nobody
go work. Like, sir, I'm ready. And it was just like, no, we're
Look
not
at you
going to
now.
move. You're going to give this gentleman the number. Oh, no, cute. So big up to the taxi man. It was a robot taxi. I wish we could have invited
So,
the wedding.
So what kept you guys together so long?
Jesus, peace. I that me really I wonder, you know, coming to know for the eagle eye. I have no clue. To be honest with you, I just feel like both of us always knew what we wanted. For me, I didn't have like a type that I was necessarily looking for. Like all girls will come and say, yeah, they want this type, tall, dark, handsome. All. I didn't have that kind of a
Too young
type.
for that.
Maybe I was ninth grade. I mean, you know, at some point you have those things, even as you're growing up. But I was just thinking, I just want someone who really loves me and appreciates me. The whole aesthetics and all of that probably can come in, but it wasn't the priority. It was, I want you to love God, have a same belief system, at least similar, if not, and just make me feel like my first prize. Like make me feel like, girl, up there, so front seat appearance and the whole 9 yards.
I feel like I'm talking to somebody with a master's degree in relationships. So let me ask you
I
this.
have a master's, you know, me still a learn. Me feel like me still a learn.
But after 21 years, is marriage hard?
Marriage is hard. Marriage is a whole heap of work. This
Kinda
gentleman,
discouraging to hear still.
no, it's not discouraging. But just like how you say to me, Renee, I'm not perfect with my eating habits. I know what I should eat, say 90% of the time, but I still have my little 10% where I will indulge in certain things. But I am 90% intentional about what it is that I put in my body. That is how I feel about my marriage. We're intentional about a bag of things, but then we have our human nature where me tough-headed. When I am focused on wanting to have my own way, only God alone can help Kevin.
So this is the part where I have to disagree with you a little bit, right? I don't want to call it hard. Words are very important, you know.
Oh my fan.
Okay,
it takes work.
Yeah.
If maybe that's a better terminology.
That's a better terminology to use.
Maybe better.
But I don't want to even say that. I think. All right. So I remember I was dating a few years ago, and the girl said to me, she was like, relationships are too hard. I'm like, relationships are not supposed to be hard. Relationships are not supposed to be work.
Right.
Relationships are supposed to be understanding. Wherein me know what you say you stay.
Right.
I know you're tough-headed sometimes.
Right.
And I know how to deal with you.
Right.
We both have our flaws, but
and we work with them.
We love each other through our flaws.
Yes.
Now, saying hard now is like, damn, we think about obstacles now.
Well, maybe it's the choice of words then for me, and I would take that back because I don't want to paint a bad picture.
The reason why I said choice of words are important because when I say hard, the first thing that comes to any single person,
they don't want it. Yes.
I do this,
okay.
I don't do it hard,
Okay.
When I live my life, I have fun and enjoy
I won't say that it's going to be an easy road. You are going to be faced with challenges, and maybe for us, I some way put it as maybe hard because of the things that we have had to come up against. So you mentioned no children. It's been 21 years of marriage. So somebody with some logical sense would say, 21 years, I wonder what's happening. That's exactly it. So, you have certain things that really heavily weigh on a relationship. And that is one of them. Infertility. When you talk about infertility with the average person, they may have gone through something maybe 2 years, 5 years. But when you say 21 years of marriage, there has been some hard. I can't put that in any other word.
Yeah.
When you talk about hard, you're talking about parents just unexpectedly dying and having to know you have to pivot all the way, like your mental health is in the toilet and have to love somebody through all of that, knowing that this is not who the person is, but I'm going to have to just keep going with him because this is unexpected. And you just want to Cause man, you talking like, sir, the things that maybe you wouldn't have given a pass on, but now knowing the circumstance that's there, it's like super, super hard.
Right.
So yeah, there are some challenges that are there that I can't use any other word to describe. And the infertility is probably one of our
On top.
biggest challenge. And of course, having like just this sudden death of my husband's dad last year, and just something that you just don't expect.
And,
You know
and
what
I think
mean?
and I think I would say that's life. I wouldn't say
Yeah.
that's
It's not the
hardship.
relationship itself, but
Yeah.
it's the outside factors that are really bearing down
Yes,
on
'cause what I
it.
would say is going through that alone
Yeah,
is way harder than going through it with somebody else.
absolutely.
So that's what I'm saying. I wouldn't say it's hard. I would say there's challenges through anything.
It's the difference in terminology for me, and I still somewhat maintain how I feel about it. And for me also, I am someone who was diagnosed with clinical depression. Loving your girlfriend who is this just free-spirited girl. I am the girl who gets up, I'll sing, I dance, I'm super talented, and you watch me morph into
A bubble.
silence. I don't even have words to speak at home. I don't want to talk. I like the dark. The dark is comforting for me. The nice conversations we're so used to having, they're not happening as much anymore because I'm just in my head.
Let's stay there a little bit on that topic.
It's a tough one. And dealing with someone who has major, not just a little mood change, major depression that literally feels like your life, even though you have everything going for you, you just feel like your life isn't worth anything, like you did not accomplish anything.
Right.
It warps your belief system. It warps the way that you see yourself, how you see your spouse. And when you're seeing yourself changing, it's a hard place to be. And that, I feel like, has been heavy for the past maybe 5 years, because I was diagnosed in 2020 after my uncle just suddenly passed. And that same year, so uncle died September, and a couple months later, I'm at work, get a call from my brother-in-law. Toronto PD is in Ontario at my house. There is something happening and it does not look good. My mother-in-law was crushed by a truck
Wow.
on life support.
Mm-hmm.
And then if that didn't get any worse, then last year she was on life support, thank God, doing much better, but still struggling, right? And she's the stronger one. And then dad just wasn't feeling well one Sunday, goes to the hospital and is also on life support. So then my husband, who is the quintessential support guy, just, he's there. I had to watch him go through what I have been going through for years, and I don't even know how to help him because I still needed his help.
Right.
And unfortunately, his dad didn't make it. And having to be here running our business by myself while he had to be there physically going through that with them.
Tough.
And feeling like I couldn't show up for him in the way that I would want to. And he couldn't show up for me. It was just this tug of war.
So symptoms. You mentioned some of the symptoms earlier of depression.
Yeah.
Which a lot of people might have these symptoms but don't know that is what it is. Because I've talked to people where it's like the symptoms can come slowly or they can hit you at once.
All at once.
So the not wanting to be around people, the wanting to be in a dark room, no TV, not eating, not showering.
And it's just like, probably even somebody's everyday life that they didn't even think was depression, to be honest with you. Because some of us, my nurse friends, we worked nights, so we're used to being in the dark. We wanted to be in the dark because we needed to sleep all day and go to work at night. So
there's
for
no
many
daylight.
of us, there was just none of that, right? But other symptoms that might not necessarily be so out there in your face, somebody just, got a little bit withdrawn. They might be somebody who used to talk on the phone a lot. No, it's just the little texts that you'll get. But then that could also be maybe the job. So, there's all these things that you're thinking is happening, but no, this person is showing you some signs. Other things that I felt like were early on for me, I just didn't care about what I was eating, didn't care about what I looked like, which is so odd for my friends. They're like, wait, you didn't care about what you look like. Yeah, there was a time. And so you're just there buying the clothing because you're just accommodating the new size. And you're not even really looking at yourself. You're looking in the mirror, but you're not looking at yourself. And that was another thing. Social anxiety, certainly that was a big one. So the crowded spaces, and I'm telling you, I am a social butterfly. That is no longer me. I get in a room with 5 or 6 people. I gotta go. I can't do all of this.
And a lot of people would say, "Oh, I'm an introvert now," and I tell a lot of people, "You gotta look deeper into that."
I'm not. I really am not. Yeah, I think maybe over time I might have swung a little bit over, but I was definitely that beautiful light that you saw. When I walked in, a room shifts to me. That's who I've always been. The table shifts to me when I'm there. And now I go in and I'll be quiet and nobody will know my name. Nobody will know who I am. I'm just sitting in the back and I'm okay in a supportive role when I have been called to lead the entire time.
Right.
That was probably some of the things my family saw very earlier on, because I would just take that back seat.
So how did you get out of that?
So I feel like I had a rock bottom moment. So 2020, Uncle passed, Kevin's mom, and then the end of December came and I was standing at work. I worked in the OB as a nurse practitioner, and I was standing against a wall because I felt like the room was spinning and I was falling over. And I called one of the girls. I said, hey, does Doc have any openings on his schedule? I want to be seen right now. And she said, yeah, let me put you in 30 minutes. I'll come get you. So she got me. She got some blood pressures and I'm looking at the pressure. I said, it's like 150 over 100? I said, girl, y'all don't know how to take a blood pressure by now?
Yeah, I think so. Yeah,
it's not me. It's not me. This is the machine. Okay. She brought 3 different size cuffs. She brought a second machine. She's like, Renee, this is what I'm seeing. I'm like, you know what? Get out of my way. I knew, but I was just being really pissy because I'm just like total denial. So I get in the room and he says, hey, can you complete a PHQ-9? PHQ-9 is a questionnaire. It's 9 questions. And it literally asks you about how are you feeling, and it's like always feeling this way, sometimes feeling this way, never feeling that way. And then the last question is, have you ever felt like harming yourself? And I went through the first few of them and I was very, easygoing, and I was very honest. And then I got to the bottom one and he looks at me and I look at him, and we both work beside each other in the same office. And I wrote no. Looking at him, I wrote no, because I would have had to be Baker acted, meaning I'd had to go to the hospital, be kept for whatever time,
Right.
and I would have been a danger to myself. That would have been on my record. And he knew and I knew, and we just kept it right there because I didn't want that. And he said, you want to get on some meds? I said, like, vitamins, minerals. What are we talking? Vitamin D3 is great for mental health. And he said, Renee, we're beyond that. You're a Jamaican girl. This is like the most taboo thing ever. Like, what are you talking about? They're going to think you're a mad girl. You're going to be like,
Yeah.
there's a big stigma, you know, like, this is big. So I said, like, what are we talking? Are you saying that you think that? He's like, Renee, come on. You do this every day. I don't want to, you know, force this on you, but I want you to feel better. I want to get that girl back that walks in here and everybody stops because that's who you've always been. But we've all said it, like, you've changed and we know you're going through a lot. So I said, okay, SSRIs, they have a good safety profile. I'm training my own doctor. Like, of course he knows. So then he's like, okay, are you good with sertraline? I said, yeah. Can I get started with just 25 milligrams, please? I'm giving my own goddamn prescription. Like, I couldn't even let go enough to just be a patient because you're always caring, you're always treating. You don't have time to be the one sick. You don't have time for anybody to be looking over you or taking care of you. And here I had to resign myself to being vulnerable. I didn't like that space, but that's how I started my journey to get help. And then I said, you know, if we're going to do meds, let's go for the long haul. May I have a referral for
therapy?
And I didn't even want to say the word. He said, I already wrote it.
Yeah.
There was a 6-month wait in California. I was living in California at the time.
Oh, he was in Cali at the time.
6-month wait for anybody to get in to see a therapist. I mean, anybody. And the therapist called me in 3 days because my people had pull. And they knew I was on rock bottom. I was just like fragile as this close. And my first appointment with the therapist was an hour. It was a video visit. It was during COVID. I cried for 59 minutes of that visit.
Really?
I just broke.
Because you have balled up inside for long, you said.
I just broke. I didn't want to be so transparent, but for some reason, it's like a word vomit. And I also think maybe I had started the meds the same day I picked them up. Was a low dose, but it was just probably a little bit of what I needed. And it never works that quickly. I'm just going to say that. I might have just had one of those circumstances where it just, you know, did that for me. And she said, I'm going to have to see you
in person
2 to 3 times a week. I said, okay. And then that's where I started. And 2 to 3 times a week just seemed like it wasn't enough at some points. And then my doctor says, we got to keep increasing your meds. I see that you're doing a little better, but you're still very weepy. I would cry at the drop of a hat. I mean, it was awful.
Was that a symptom?
No, it's actually just me being depressed. But no, you know, my body, the neurotransmitters are, you know, getting help, and my own body is kind of rebelling, and me just, I'm feeling crazy. Like I'm feeling something. And then he settled at about 100 milligrams after several doses up. And I was like, oh, who's this girl? I could focus. I could just be so clear again. I didn't remember what that was like, even though it hadn't started that long. But the weight of what I was feeling was so heavy. I didn't know what it felt like to be normal, if that's even a thing, right? And so that's where my help started and the therapy started. And I would never, ever tell anybody who's going through this not to go to therapy. It's a big deal. I said, get a therapist before you need one. Your therapist is going to be like on call for you. have somebody that you can sit and just talk to, if it's even one session a week. Talk therapy was the best thing that ever happened to me. And then the cognitive behavioral therapy came. You have to do the work. And I bought the books and I had a purpose. So now things are a little more balanced. You know, your meds are balanced, and I'm not afraid to share that. You know, as a Jamaican woman, as a clinician, as somebody that people might know, yes, I take antidepressants because without my medication, I can't function.
So do you think, because we only have a few minutes, but because I didn't plan to go into this, but this is hard. This is
my hard part.
This is something that I think today you were supposed to do today.
Yeah.
But with depression, what a lot of people don't understand is it starts slow, but your serotonin, all these hormones in your brain, they diminish little by little until they're non-existent.
Listen, it's
now
awful.
That's where the meds come into play to push you back. A lot of people don't like them because I guess it depends on the one you take. Because some people feel like zombies.
Exactly.
On these meds.
Depends on the one you're taking. And if you are working with a clinician who understands how to manage this well, then you can certainly get on something at a low dose and then titrate. And you don't have to titrate every symptom. You can literally just have the patient talk to you, be in touch. Follow-up is going to be very important. Writing down my symptoms was important. My sex drive changed for the worse on SSRIs. I did not have a libido. It was not decreased. It just was not existent. So that's a big side effect that a lot of persons are not willing to talk about, but I'll share that. So I didn't have a libido. Second thing is, with SSRIs by themselves, you can gain a small amount of weight, not so much like the atypical antipsychotics. It's a very different class, but the SSRIs can cause a bit of weight gain, but if you taper it with something like, say, Wellbutrin, then it's weight neutral, then you don't have to worry about that. If you're thinking about getting pregnant, the SSRIs are the safest class of drugs studied for a pregnant woman to continue in her pregnancy if she suffers from depression. So it is good to have a clinician who understands this, knows what your plan is, even if it's a year from now, because we need to get you in a good place and get you in, at least a dose that's going to work well for you, so that when you're pregnant, you already have the hormone shifts and the tears are coming. We don't want you to have such waxing and waning with these. We want you to actually have good balance.
So one last question about that before we get to the closing question. Do you think a person could ever get off of it?
I think that
or work your way to get off of it.
People have tried. I don't know of many persons who I would say have been completely 100% successful with coming off of them. It's because neurotransmitters in your brain, if you decide that you are going to miss your dose for 1 or 2 or 3 days, when I tell you, you feel like you're going through withdrawal, it will kill you if you decide that that's what's going to happen. You feel the synapses firing in your brain. It is not a good feeling. So if you are thinking about discontinuing, make sure that you're under the careful guidance of your clinician and it is advised by them. So it's a tapered way that you're going to do it, and it's going to be over a certain amount of time. This is not something that today I'm going to take my last dose. This is something that has to be tapered over weeks, sometimes even months, depending on how long you've been on it.
Have you ever heard about or even thinking about trying something like the
like ashwagandha,
mushrooms?
like that? Yeah, I take the adaptogenic mushrooms.
No, there's another one I'm talking about where you have to have the shaman. That's the name of him. Somebody has to remind me the name of it. It's like they have to be there present for you to try the psychedelic. It's a psychedelic drug.
No, I've not, because I try to, like, I'm very herbal as well and plant-based, but I try to get my therapy certain ways. So I know for sure, like the adaptogenic mushrooms have been good for me for my cognition and focus. I do take my ashwagandha so that I can maintain my stress levels and so on. But in addition to adding anything else to my therapy, I'm very cautious about
I was
that.
talking about ayahuasca. That's what I was talking about.
Okay, I'm not familiar.
So if you
with
can
that.
research it, that's something that a lot of people have tried and it has worked for them.
Okay.
That's a natural practice, but it's something that it's like a doctor have to be there for you to
For
monitor.
doing it.
The shaman has to be there with you to go to the
Okay.
ayahuasca because you go to hallucinations, all that stuff.
All of that.
Yeah, you throw up. It's that whole process. They have to be there with you.
no,
For it.
that-
But 90% of people I heard that tried it. It works
They're
for them.
able to come off.
Yeah.
So there are some people who have clinical depression that is like literally reactive to therapy, and they need a whole lot more. They need, like, lithium to balance out their moods. But in addition, things like ketamine
Yeah.
infusions have been really
But
good.
a lot of people get addicted to it.
Exactly.
So
Yeah. That's a tough one. Us Jamaican Caribbean people, we don't talk about this.
Mental health. I'm glad we've been able to touch on it today. But
Yeah.
so in closing, I have 2 closing questions for you.
Okay.
The last one I'm going to answer with you.
Okay.
But the first question is for somebody that wants to get into your field, in the medical field, doing what you do, as everybody can see that you're educated about what you do, because you don't just do the typical practice.
Right.
You have a whole lot underneath
Yes,
because your
the
primary
big
care,
umbrella.
your different things, and you have questions about even anything health-wise.
Yes.
So what advice would you have for somebody that wants to?
So if they're coming in from high school and they're going into college, don't just tell them that you're going to do liberal arts. Be intentional about what it is that you want. If you've found a particular program for nursing, find out what the prerequisites are for that program. So then when you are entering into your first year of college, you're not wasting that on liberal arts courses. You are literally working towards that goal. So for the most part, you're going to need your chemistries, you're going to need your bios, your medical microbiology, your medical terminology, certainly 1s and 2s for English, 1s and 2s for maths. Those are the basic
For
of
Jamaica.
the core courses. Not just, no.
1s and
I mean,
2s.
when I mean, English 1, English 2 is what I mean.
Yeah, remember we don't really do it
We
like
did
that.
this long time ago, right? I'm sorry.
Remember here in America,
So
it's
here is a little different.
Yeah.
All right. So English 1, English 2, math 1, math 2. I don't know if that's algebra or whatever it is
Yeah.
here. I've done this like
Our
20
math
odd
is
years
different
ago.
than our English is
Completely,
different, yeah.
right? Okay. So you want to actually just have that focus, but focus it on what that particular program has, and make sure that if you had to pivot and switch to a school, then at least you have majority of credits that can be taken from that school and moved over. Secondly, check the accreditation for these programs. Not all of these programs are accredited. So you don't want to be in a school doing all of these things, finish a nursing program, and can't take the NCLEX, which is the actual examination that qualifies you to apply for licensure in the United States. So you want to find out about the accreditation. You also want to find out about their NCLEX pass rates. Is this a school where they have a first-time pass rate of 98%? Or is it a 70% pass rate? Because that's horrible, right? It's a very competitive world. So find out about those things first and foremost. And then when you've gone through your nursing program, my biggest thing to pass your NCLEX, take as many past paper questions as possible. I used to do maybe 500 questions a day leading up to my NCLEX. I finished school this week. I sent out for my authorization to test. The day I got it, I set my date. I went and did my exam. I was the second student in my class to do my exam. And I walked out of that exam feeling like I'd been run over by a truck. 2 days later, I had my pass mark. Same thing with my NP. My NP program, I took 45 minutes to do my 3-hour exam.
Wow.
I'm just that girl. Truly, I am. But, it's not a boast or brag thing, but I feel good about that
Yeah,
because
you're
it's a
putting the right
level of
thing.
preparation, right? So I would want for you to position yourself accordingly. Make sure you're setting yourself up for success. If you have to work, know that your work is going to be secondary to this schooling for maybe a short time. If you're able to get the associate degree to start and then allow your employer to pay for the bachelor's and pay for the master's, I would do that as well.
And
Getting some form of tuition reimbursement, because right now we didn't get any of that. So we have to pay big student
And one
loans.
important thing you spoke on too is the passion to actually do it, because
Exactly.
it's challenging, but when you have a passion for it, you're willing
Yes.
to go through any hardship that comes
Absolutely.
with.
And don't just jump into it because, your family says it's the one that gets you the job, right? Coming in from another country, everybody knows in the medical field that's probably where you're going to get a job. Don't do it if you don't love it. We have enough people who are already doing it that don't love it. And if you are thinking about going into travel nursing, I didn't mention that, but that was a big part of my life for 10 years. Travel nursing is great, but do not enter into travel nursing unprepared. You are going to be thrown in and expected to function. If you came to my hospital as a traveler, you had to have all the clinical skills down pat. I'm not here to teach you. You're here to cover a maternity leave, a shortage of staff. So I can't be stopping to teach you something that you did not learn because you decided to come travel after 3 months of being a
Right.
nurse.
I think
Give yourself time.
we're
2 years.
we have I have about this much questions that we we didn't ask,
Oh
but
my gosh.
I'm definitely gonna have you come on again. You know that
Okay.
we're gonna chop it up again.
Absolutely.
But
Definitely.
for our final question,
Yes.
I want you to leave the audience. Our podcast is called Student to Life Podcast, and you left a lot of knowledge today, but I want you to give the audience something that a key lesson that you have learned. I would say over the years of your life.
Yeah.
If you can say this one lesson you want to leave everybody with today, because I know there's a lot, but just one that comes to mind.
I want you to know that you are not always right, and you have to remain flexible and teachable at all times. It is not enough for you to think that because you have studied and have this broad knowledge of certain topics that you are the expert in this topic at all times. As a student to life and as a medical professional, I am always looking for the next information, something else that is going to enlarge my courts, that is going to benefit my practice, and that will allow my patients to thrive. And just by doing that, I've been able to keep every patient that I've had over time. So learn the lessons as they come. Be a student to life for real, and know that you really want to take the time to suck in as much information as you can. Not because you're not in a formal education or doing school right now means that you no longer read a book or listen to a podcast or listen to an audiobook. Always be just willing to research something. Google is not your research. Facebook and TikTok is not your research. You want to go to scholarly places to get your knowledge base so that at any time, whenever you're asked or, somebody points at you, you can literally spit some truth and you can feel justified with what it is that you're selling. Yeah.
For me, I was actually listening to my audiobook today on the plane back, and I'm still on this book, Outwitting the Devil by Napoleon Hill. I would advise everybody to do the audiobook. not the hardcover, because the audiobook you get a better perspective of the conversation he actually had with the devil. And one of his tactics that he spoke about in the book is called drifting. Now, drifting is considered you drifting into bad habits, negative thoughts, things that are detrimental to your life. Basically, you're drifting to these things that you're practicing that's not of your God self. That's what they call it, your godlike self. Because we believe in the book, he believes that God is not a spirit. God is in us and our habits. The things we do reflect our godlike self. And also, the devil is not a man with a fork. The devil is also our bad habits and the bad things we do with our lives. So the way to not drift into that cycle, we spoke about good habits, feeding those good habits, being educated on everything, actually, because if you leave space for uncertainty, that's when the devil creeps in. Yeah. So a part of not drifting is education.
Absolutely.
Another part of that is being able to be convicted to something that you want. You want something out of life, being able to be convicted, not be distracted.
Right.
These are the qualities that a non-drifter, as he calls it, has. And when you're convicted to a certain lifestyle, your eating habits, all of these things, when you're convicted to this lifestyle, you leave no room for the bad habits to come in, which is the devil himself.
Of course.
So understand that the devil is not a man with a fork, and God is not a spirit that we speak of. God is in us and the habits that we have. So feed that.
Gotcha.
That is my advice for today.
Okay.
So, Dr. Renee.
I love it. So,
Dr. Renee.
Yes, sir.
I want to say I very much appreciate you. We will have a part few for this episode because we could have went another hour.
Yes, it was such a pleasure
Yes.
being here. I thank you for your transparency with your journey, your humility about even what it is that you do. And when you realized, hey, this wasn't really for me anymore, you learned how to pivot and did something else that fed your soul and that you were comfortable with.
That's very important for all of us.
It is very important.
So again, I want to thank you for coming on. Absolutely. And people, don't forget to before I get there.
Yes.
Follow Dykal Wellness.
Yes, so it's at Dykal Health _wellness on all platforms. So we're busy on TikTok, but also on Instagram and Facebook. And
you're located in Fort Lauderdale on Commercial Boulevard.
Commercial and Federal Highway, right across from Holy Cross Hospital. And we're
and if you heard all the services that she offers, I'm actually looking for her to be my primary care, but she don't take my insurance.
I will take your insurance. Just kidding. But like I said, it's just the copay that persons pay us, and we'll use your insurance for everything else.
Okay, so
take care of you.
Find her on Instagram, find her on TikTok. You have a website too?
Yes, it's www.dykalwellness.com.
Okay, and for me, go find us on Instagram at Student Alive Podcast. And you can find us on YouTube at Student Alive Podcast. We're going to go back on iTunes audio podcast and Spotify. I'm going to make sure I upload these new episodes that I'm dropping on there on those platforms too. So Student Alive Podcast everywhere. And make sure you like, share, subscribe.
Yes.
Thank you.
Thank you.
Again, we'll see you again for another episode real soon. Peace out.
Bye.